Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant Orthopaedic Surgeon at Lotus Speciality Clinic, and today I am going to talk about knee pain in young adults as part of our Common Orthopedic Problem series. Problems in young adults can occur due to injuries to the knee, like twisting injuries which can affect the ligaments or tendons, or it can be because of injuries to the cartilage structures. This can cause anterior knee pain, which is pain in the region of the kneecap, otherwise called as chondromalacia patella. This problem with the cartilage is mainly due to softening of the cartilage structure, which is the covering of the joint surface. These young adults usually present to us with pain in the knee, which is more aggravated when they are doing stairs or sitting cross-legged or squatting or involving any kind of sport which is in an inclined surface like running up the hill. Once they present to us with this, we normally investigate the problem, by which we take x-rays to see the alignment of the knee structures and to see whether there is any bony problem in the knee joint. If that is fine, then we investigate it with higher investigations like an MRI if we suspect a cartilage injury. Once we have identified the problem that is involving the cartilage, then the treatment for this is first avoiding the precipitating cause. So if a person is involved in a lot of sporting activity, we ask them to rest the knee and avoid any kind of knee bending activities like yoga, cross-legged sitting, squatting, etc. Usually the pain normally settles with this. However, if it still continues, then we prescribe them some non-steroidal anti-inflammatory medications to reduce the inflammation around the cartilage. Along with this treatment regimen, a short course of physiotherapy to strengthen the quadriceps muscles around the kneecap, especially the VMO, which is on the inner side of the knee cap, helps to strengthen the knee joint and prevent any wear and tear of the cartilage. And also put them on some supplements which we call them as nutraceuticals. So something like chondroitin sulfate, glucosamine, collagen peptide, diacerin, curcumin, a lot of other medications. If this helps with the knee pain, then well and good. However, if the symptoms persist further, then we have other treatments like injections into the knee, like stem cell injections, in which we give growth factors which will improve the quality of the cartilage and prevent the young adult from going in for severe pain in the knee or arthritis setting in at an earlier stage. Hope this short video helped you out. Please like, share and subscribe. Thanks.